Health Minister Dr. Zweli Mkhize has said the latest number of infected healthcare workers is 24,104 as of the 2nd of August, with 181 fatalities recorded. This means that the national infection rate of healthcare workers stands at 5% of all confirmed cases. On the 17th of July 2020, the WHO reported that healthcare workers account for 10% of the global infections. The Department of Health said it noted with concern increasing allegations of healthcare workers contracting the coronavirus in the line of duty due to lack or poor quality of personal protective equipment. December Mavuso, who is the Deputy General Secretary of the National Education, Health and Allied Workers Union, Nehawu, joins me now via the telephone. A very good evening to you, Mr. Mavuso. Thanks indeed for your time. So these concerns that the Minister is raising is what you have been raising as a union for a very long time now.
Yes, good evening, Griselda. Yes, we've been raising since lockdown in March. We've been raising concerns about the protection of the frontline workers. Today, the Minister has confirmed that the cases of infections are over 24,000, which is 5%. And in our view, 5% is too much. 24,000 of the employees in a situation where we have a high vacancy rate, they further depleting the workforce that we need to save lives in our hospitals.
So, Mr. Mavuso, I know that just recently you had released a report into the state of affairs after a fact-finding mission at the country's hospital. What is the current situation on the ground?
The situation is very bad. Workers continue to complain about the lack of protection because of the shortages of PPEs. In the report that we gave the Minister, we detailed our findings and indicated which institutions, which hospitals in the 4 epicenter provinces we visited. And the 4 provinces, if you know, they house a lot of hospitals. The KZN alone, there's quite a number of hospitals, Eastern Cape, the Western Cape, and Gauteng. These are big institutions. So if you sample with those and the problems that are there, you realize that, we have a big problem across the country. Just since yesterday, we've been meeting with our members, representatives of our members in the different sectors, social development, health today, representatives of nurses across the country. They continue to paint a very bleak picture. For instance, we are told that in the pharmaceutical depot in Mthatha in the Eastern Cape, there's no stock there, but the institutions that are coming from that area are not allowed to even order PPEs from the Port Elizabeth, depot. So it is very bad.
So the Minister also said today that provinces have been instructed to ensure that the occupational health and safety committees are established in every province, district and health facility. Would this be something that you think could assist with the current situation that you describe? Well,
some of these statements the Minister is making, it's not for the first time. They are rhetorical statements in our view, because, for instance, let's take the issue of the occupational health and safety committees. We met with him on the 8th of April. We agreed in that meeting that there must be, across the board, establishment of those committees in terms of the law. There was a directive from the Department of Employment and Labour. There was a directive from EPSA in terms of the return to work strategy, that one of the conditions is to ensure that these committees, they exist because they are responsible for conducting risk assessment, for implementation of prevention and control measures, including dealing with the whole issue of the PPEs and the training of workers in terms of how to protect themselves and the correct use of the PPEs. That has not happened. He repeated that after we've issued our statement, that I have directed that in June, occupational health and safety committees must be established. They have not been established. He's repeating that today. There are no consequences. What he's supposed to be doing now is to deal with the people who have failed to implement those decisions and compliance with the law. So
why do you think, Mr. Mavuso, there's this lack of accountability? Because also within that statement that was released by the minister, he said that action should be taken against those who have not implemented some of this action to ensure that those in the front line of the fight against COVID-19 are safe.
Look, he should be taking action. He should not be issuing a rhetorical statement. I'm saying he said already in April and in June, do this. It has not happened. He acknowledges that today, right? And he still says, I'm giving people a week. Within a week, well, good luck. We'll see. Maybe they will perform a miracle. Because this decentralized approach of government and leaving everything the discretion of managers who we know that there's serious issues of incompetency. They are hostile to workers, to unions, even if the law requires that in some of these issues we work together. We're waiting to see what the minister is going to do. But we doubt that within the week he's talking about a miracle will happen.
Mr. December Mavuso, the Deputy General Secretary of the National Education, Health and Allied Workers Union, Nehawu, thank you very much indeed for joining us.